My name is Rajni Parmar, and I will be presenting today on use of diffusion of innovation theory to implement universal participation in influenza vaccination policy at University of Arizona Health Network.
Today, healthcare in Arizona has become 6 times stronger because now UMC, Diamond Children's, UPH Hospital, Physicians Group, health plans, and affiliated clinics have all formed the state's first academic medical network, bringing world-renowned specialists and leading-edge care to more people than ever. Introducing the University of Arizona Health Network, because academic medicine is smart medicine.
Mission of the University of Arizona Health Network is to advance health and wellness through education, research, and patient care. I have selected this organization because health promotion is part of University of Arizona Health Network. Because of this standard, our organization supports the community through a variety of programs, including free screenings, health and wellness programs, state-of-the-art research, sponsorships of charitable causes, and participation in health fairs, medical conferences, and other community events. The Pima County Community Health Needs Assessment shows how the University of Arizona Health Network is a part of our community through its medical services, community outreach, and external relation programs. Social ecological model of health promotion frames the University of Arizona Health Network. The organization uses an ecological approach to improve and promote employees, patients, and community health. Using this approach, this organization focuses on both population level and individual level determinants of health and interventions. It considers issues that are community-based and not just individually focused. It understands that health is determined by influences at multiple levels, for example, public policy, community, institutional, interpersonal, and interpersonal factors. This is Alex Adams. She is a marketing specialist for marketing and community services. And I have Katie Riley here. She is the Director of Public Affairs for University of Arizona Health Network.
We have various programs. Internally, we have a smoking cessation program we offer for employees and their families. In addition, we are a smoke-free campus to support that initiative. We also offer a healthy lifestyle challenge to our employees that encourages, we offer an EAP program for our employees. In addition, we are a smoke-free campus, and we offer a smoking cessation program for our employees and their family members. In addition, we encourage healthy lifestyles, and we support that with our Healthy Lifestyle Challenges, which offers opportunities for exercise instruction and nutrition counseling. On an organization-wide level, this year we adopted a policy requiring flu shots for all of our employees. On a community-wide level, we recently partnered with a local organization to encourage community members to sign up for either the health insurance marketplace or access, and we made that process accessible to them. We had about 10 enrollment days, all varying times to accommodate various schedules and make sure they signed up before that March 31st deadline.
Okay.
We're very involved in the community. We participate in roughly over 100 community events throughout the calendar year, and at those events we offer free screenings, we'll have guest speakers, we participate in lecture series, we offer bone marrow drives. In addition, we have an organ donation registry. On a local level, we also encourage student tours to take place, or even job shadows with some of our nursing staff. We also offer a community internship program where key community leaders come in and act as interns throughout our hospital for about a 12-hour period. They scrub into surgery, they might shadow a physician, they really see all facets of our organization.
Health Center is committed to family and patient-centered care. We know that the best way to treat our patients, for them to get well, is to include their entire family, and that even includes sometimes their friends and neighbors. So we have virtually unlimited visiting hours because we know that is healthy for our patients to have that social contact. We have family rooms where we allow families to relax and shower and use computers and make a home for themselves inside our hospital while their loved one is ill. We provide support groups. We have a chaplain. We have chapels. We have a number of services geared entirely to make family and friends feel comfortable in our hospital. It's a public policy arena where we're very active. We have lobbyists and government relations specialists here in Tucson and also up in Phoenix, where they can be close to our legislators at the Arizona State Capitol. And we try to influence legislation for the good of Arizona, for the health of the people of Arizona. We've been very active in expanding access and in other important issues related to health in this state.
Sure, we also recently participated in the Community Health Needs Assessment, which was a partnership between our organization, TMC, and Carondelet, and it involved a focus group and various surveys to assess where we were as a community and then benchmark and develop a plan to address the health needs of the community and create a plan moving forward to improve the health of Pima County.
The University of Arizona Health Network developed a new policy in September 2013 on universal participation in influenza vaccination, which mandates all UAHN healthcare personnel to receive an annual influenza vaccination. Implementation of this policy, guided by evidence and diffusion of innovation theory, helped increase immunization rate among its healthcare personnel to 90%. Hi, this is Elaine Hines. She's the Director of Employee Health at University of Arizona Health Network.
We would have a healthier employee. That's probably one of the most important things. The second thing is that we decreased our absenteeism rate. Our compliance rate went from 51% who participated in the immunization vaccine last year to this year, when we implemented this policy, to 90%. Another thing would be, one of the things is that was probably where our employees they felt some of that didn't want the flu shot, let's put it that way, and they felt that was against their personal rights to have anybody tell them to put vaccine into their body. They didn't feel that they should be mandated to take this, which resulted in a couple of our employees, 2 to 3 of them, who voluntarily terminated their services with our organization. One of the things, the barriers or challenges that we had is we did not have enough staff. We weren't able to provide the access that we wanted to our off-shift people. So as the campaign went on, we did improve that, but when we implemented it, we didn't have that in place. The fifth process that I think really is probably one of the most important things is that we did achieve herd immunity, which does reach out into the community, protects not only internally here at UAHN, it protects members of the population in the community by our increased rates. So I think those are probably the processes that... Some of the barriers, I think I kind of touched on them earlier, but is access. Our office hours are from 7:30 to 4, Monday through Friday. We are a health organization, we're 24 hours a day. Therefore, access was difficult for some of our employees that worked our off shifts. And so we did, as we started into the initiative, we started making vaccine available on the floors that our nurses would administer, Also off-site areas that didn't have any nursing staff. It was difficult for them to get away from their job to come in. We hosted we looked at leadership, being a role model, providing enough resources, enforcement of the policy, and making counseling available, and just making sure that employees understood that this wasn't punitive, this was to their advantage. It was a free vaccine, and that actually it was there to help them.
Using diffusion of innovation theory lens enhanced my understanding of various process factors involved in implementation of new idea or policy. This theory is a good fit for my research area as I plan to develop a protocol on application of foot massage for individuals undergoing MRI. And now that I understand factors involved, barriers, as well as role of opinion leaders in diffusing an innovation, it might be easier for me to implement the protocol once I am done with my research study.